Hello and welcome. Good afternoon, everyone. We're so glad that you joined us today for our webinar on a roadmap for investment in mental health. My name is Allison Neiman, and I'm the Executive Director of Mindful Philanthropy. Mindful Philanthropy was launched in 2020 with the mission of catalyzing impactful funding to mental health, addiction, and well-being. In our work, we connect and we convene funders through our gatherings. We guide philanthropic funders towards strategies and impact, and we uplift impactful opportunities for investment. Just 2 weeks ago, we issued a call to action for philanthropy to increase philanthropic funding by 5 times to $35 billion by 2035. This was issued with the release of a new guidance series that we launched called Mental Health at the Center. This was launched to catalyze significant and transformative investment to enable our communities to thrive. The first document that was released is a roadmap and a high-level view of mental health needs, gaps, and opportunities for philanthropy. It's the case for investment. And in this entire series, we aim to equip all of philanthropy to support mental health in their funding and give guidance on the most strategic priorities for philanthropy to have impact. Today, our conversation will focus on the second piece of guidance in this series, the roadmap for investment. Earlier this year, we brought funders together in focus groups to ask about gaps in funding mental health and what would be most helpful for all of philanthropy to integrate mental health into their work. A few things emerged clearly in those conversations. There was a need for shared language, shared strategy, shared metrics, and a way for funders to understand how they could best contribute. Our series, Mental Health at the Center, is responding to these needs. So before we get started, I'd like to go over a few housekeeping items so you know how to participate in today's event. At any time during the webinar, you'll have the opportunity to submit your questions to today's presenters. To do so, just type your question into the Q&A box at the bottom of the control panel, and as time allows, the presenters will address as many questions as possible throughout the program. We also are recording the webinar and will share the link after the event. And additionally, we'd like to point out that captions are available and subtitles for today's discussion. You can turn them on by clicking the closed captions button below, but please bear in mind that they are automatically generated by Zoom in real time. So we apologize in advance for any inaccuracies they may have. So as we dive into the strategy and the 5 key priority areas for investment, I'm pleased to introduce welcome our Director of Programs and Knowledge, Kristen Ward. Kristen?
Thank you, Allison. My name is Kristen Ward, and I'm the Director of Programs and Knowledge for Mindful Philanthropy. And I'm excited to share this work with you. As Allison mentioned, these are 2 parts of a series that we launched earlier, just a few weeks ago. The first being the case for philanthropic investment, and the second, which you'll receive tomorrow, a roadmap for strategic investment for mental health. And as we think about these documents, they're just really a starting point to help all funders invest in key areas of the mental health sector. Whether you're new to mental health or have been at this for a while, we feel that there are some really strong pieces of this work that can take hold in your strategies, can equip you in conversations with other funders that you want to bring along to this work, and also help to guide investments that can most effectively and make a difference. As we've seen over the last 5 years, there's never been a time where there's been greater attention to the issues of mental health and addiction. And when we launched Mindful Philanthropy, we felt that all funders needed to attend to these issues. And now, as we've seen in recent data, it's expected that about half of the world's population can expect to develop a diagnosable mental health disorder by the time they turn 75. That means this is everyone's challenge and everyone's opportunity to create an impact and to make a difference within the experience that we have in our communities, the experience that we have in our families, and the experience we have in accessing healthcare, whether that be at school, at work, or in the health system at our doctor's office. The impact of mental health is pervasive, not only on individuals, but also on our economy. It's estimated to cost the global economy about $5 trillion annually, and this is about $1.8 trillion in the United States. This includes loss in workforce productivity. This includes healthcare costs. This includes other challenges as it thinks about the ripple effect that mental health has on our families and our communities. Over the last few years, we've taken a deep dive into how much funding is already going to this space. And as of 2018, about 1.3% of all foundation giving was oriented toward mental health and addiction services. This is only, again, about 5% of all foundation giving to health. Based on this, we estimate that today, of the nearly $500 billion that is given by philanthropy every year, about $6.5 billion goes to mental health. This is just a drop in the bucket, leaving so much opportunity for funders to take action and to dedicate greater investment into the mental health space. So as a result, as Allison mentioned, this is our challenge to all funders. That by 2035, we collectively increase the total amount of philanthropic funding dedicated to mental health, addiction, and well-being by 5 times. We anticipate that in the year 2035, we can see $35 billion in investment from all types of philanthropy, including individuals and foundations and corporate funding and any other type, so that we can really prioritize those investments that will have the greatest difference. But in order to do that, we need a roadmap. So following on the case for investment that we released just about 2 or 3 weeks ago, we are releasing our next part of this guidance tomorrow with a roadmap for strategic investments. In this roadmap, you will find 5 priority areas. This is intended to serve as the preliminary collective strategy to address the mental health needs of all severity of all people, and our really collective issues that align with all other social issue areas. Again, this is intended not only for those funders who are new to the space, but also those existing funders who have been long addressing mental health challenges, so that we can prioritize those investments will have the greatest potential for impact within the mental health space. So in our conversation today, I'm going to quickly just share a little bit of each of these 5 priorities, and then I'm excited to turn to our panel discussion, who will dive a bit deeper into each of these and thinking around real-world investments and how this aligns with potential for impact. So the first one, community, is intended really with this goal statement to reinforce community structures to reduce social isolation, rebuild connection, and provide the first line of support for all those needs. This includes fostering social connection, including those infrastructure and opportunities and programs and places where people can connect in community to foster that social connection, to reduce social isolation. It also includes embedding and uplifting the opportunities to promote belonging, meaning, and purpose into programs that are already serving youth, or serving aging populations, or serving other community members, to really reinforce those opportunities and align with opportunities to support mental health. And then lastly, ensuring that we have ways to treat people in community. This includes those who experience the most serious and severe mental illnesses, as well as those who are just struggling to get by on a daily basis, but may not have a specific diagnosis. The second is around youth and their support systems, and in ensuring that not only young people in the places that they spend time, like school and home and community, but also their support systems have the resources, skills, and services that are needed to prevent and address mental health challenges. We really want to lift up the opportunity to support parents and caregivers here, as well as expanding the well-suited support and attention that has gone towards school-based mental health over the last few years. And then lastly, thinking about every place and adult that is able to engage with young people in sports programs and recreation and in choir and music and other after school and extracurricular activities, that mental health is embedded into each part of that. Thirdly, we have the mental health workforce, which again has gotten a lot of attention, but needs a full spectrum approach to address the needs of mental health from our community health workers and our other community members who are providing low levels of care and resources in that first line of support, all the way to our psychologists and psychiatrists and other clinical providers to ensure that we have available providers that are reflective of the communities that they're serving, to increase access to care and reduce burden on the health system and other systems that are supporting access to care for mental health. Fourth, we have building a comprehensive crisis response system, and ensuring that we can build an adequate approach and system from a person to call all the way to the beds and inpatient units that are required to support people who are in crisis and need long-term care, so that we can reduce the number of suicides and overdose rates, while also reducing that pressure on emergency rooms and jails as we see in our communities. And this is an interesting one that we've seen funders somewhat struggle with over the last few years since 988 was authorized used by legislation, of how philanthropy can really invest in ensuring a comprehensive crisis system. So we call on funders to learn the local landscape, to support coordination and alignment, to think about what is the opportunity for convening and setting the table and bringing folks together to learn and understand and align on opportunities. And then also ensuring that there is an eye toward equity and learning as we continue to expand and grow our ability to respond to times of crisis. And then lastly, we call on funders to support expansion and implementation of what works. We have models, we have programs, we have the knowledge, and yet not all people can access them. So our goal is to enable universal access to the gold standard models of mental health care so that we can alleviate issues of access, availability, and especially quality. So making sure that those models are implemented with fidelity, but are ensuring that all people are able to access the best care that they can get for whatever condition or challenge that they're experiencing. And this includes ensuring that philanthropy can support quality technical assistance. In many cases, we have financing and policy that allows these models to implement, but community-based organizations and mental health clinics and other providers and other community-based organizations don't have the visibility or the capacity to really implement them at the level that they need to, which prevents a really great opportunity for philanthropy to dive in and provide that support, while also thinking about where are there opportunities to continue to reform the policy context and landscape, so that there is more adequate financing coming from the public and private sector, and really thinking about the role of philanthropy to catalyze that initial spark investment so that other larger sources of funding can take hold later on. And then lastly, activating those best practice programs. And in the guide, we provide just a sample of some of those programs. There are many, many, many more, but we hope that you will engage in thinking about what are the needs and opportunities in your community to implement those best practice programs with partners, and ensuring that those folks can access the care that they need. So with that, I'm pleased to be able to turn over the conversation to Joe Pyle, who's a founding board member of Mindful Philanthropy and the president of the Scattergood Foundation, who will join us to moderate our panel of experts and really dive in to greater impact within this space.
Good afternoon, everybody. First, I want to start out by thanking Allison and Kristen for their leadership on this critical issue. Also, I want to thank the over 200 people who registered today and the over 100 people that are actually on this call. I think it states that it is a focus area for all of us, and I'm excited for the conversation we're going to have today. In this conversation, we'll hear from 4 leading experts in the field of mental health on how philanthropy can transform the way we experience and care for mental health challenges through significant coordinated investments in the 5 key areas that Kristen just outlined. I'd like to start out today with a question to Dr. Tom Insel. Dr. Insel is the former director of the National Institute for Mental Health and has spoken extensively and written extensively on this topic. Tom, I'd like for you to start us off today with, where do you see the current mental health sector? What does it look like today? And what have been the major evolutionary points in the last few years?
Well, delighted to be here, Joe. And again, thanks to Allison and Kristen for convening this. And great to have so many people who are on the call who are interested. Look, the word that usually comes to mind when people ask about, the mental health sector is crisis. That's a word that the president has used. We've heard it from leadership of both parties in Congress, from governors. It's 90% of Americans, according to the Kaiser Family Foundation, think that we're in a mental health crisis. The way I would see it is it's really not one crisis. There are at least three different crises going on at the same time. One, and we'll talk more about this, I'm sure, is the youth mental health crisis, which is new. And a lot of that, as to your question, was driven, I think, by COVID. It was happening before for a bunch of reasons, but certainly it's been more prevalent since the onset of COVID. And it doesn't seem to be going away as COVID recedes as a viral threat. The second bucket is really serious mental illness, schizophrenia, schizoaffective, severe depression, or bipolar illness, those mental illnesses that disable people. And that is more of a crisis than ever, not so much because the prevalence is up, although it is up a bit, but because the care system is failing. And you see that with rates of homelessness and incarceration and just the failure to help people. And then the third, for this trifecta, the third area is substance use disorder, which has become its own crisis, largely driven by the advent of drugs that are so much more lethal, like fentanyl and now xylazine. And so we're seeing huge increases in overdose deaths, now over 100,000 a year. Last thing just to mention is we have yesterday, the annual report on the prevalence of all these things was put out by the federal government. It's SAMHSA, the Substance Abuse Mental Health Services Administration, that covers both mental health and substance abuse. And they do a big population-based survey every year. Those numbers that came out yesterday, I still haven't been through all of them, but when I look at it quickly, well, and I think everybody might want to take a look at this. What's really striking is the way in which the people between 18 and 25 really jump out at you. They have now 50% of them have a mental illness or substance use disorder, and yet 50% of those people are not getting any sort of care. The rates of serious mental illness and the rates of severe depression are up 80% from 2015. So these are really big changes in that particular subgroup, really emphasizing that part of the trifecta around youth mental health. It's just getting worse. It's really quite striking, and we're probably in territory where we've never been in before. And you can see that just in terms of overdose deaths and suicide deaths, what we call deaths of despair. Last thing I'll say is, when we look at where does this take us and where are we kind of missing the most, I guess all of the pieces of the roadmap I would agree with, but I really focus on the first one, on the one about community, and one I hope we can come back to talk more about, because I think in terms of your question around what's the picture of mental health sector, it's this lack of community, which many things will track back to. And I think that's a place we want to be able to dig in and really provide some focus. So I'm delighted to see that in the roadmap.
Thank you for those comments. And I know that a lot of your data points will be in the briefings that will be put out, but I'll ask that Allison and Kristen share some of the other data to people that have registered. And I know when I finally get to Dr. Shim, she'll talk a little bit about community. But before we get there, I want to welcome Dr. Kathy Pike to today's panel. And Kathy brings a very unique blend of academic experience working with nonprofits, but also has done a lot of work in the private sector. So Kathy, I guess what I would want to ask you today, and again, keeping these 5 priority areas in mind, where do you see the greatest opportunity today that we can make a difference and that philanthropy can get behind?
Thanks so much. It's a pleasure to join you all. I joined Tom with the concerns that he raises. And I think he and I both, though, there's another side to the story of great optimism around where we are today compared to where we are 10 years ago on certain fronts that will make a huge difference going forward. One is that we are talking about mental health, right? The issues around raised awareness across communities. It's remarkable where we are in a window of a relatively short period of time. And that's the beginning, an essential beginning in being able to make change. And a piece of course, COVID was a piece of pulling the curtain back on the serious issues that we have. But another reason why people are talking about mental health, I believe, is that we know a lot more, and we're doing a much better job getting the data out for people to understand, and getting the data out not only on the prevalence rates, but on effective treatments, right? The story of effective treatments, effective interventions, and knowing how to document that is really, really important. People don't invest in problems, people invest in solutions. And there are a lot of good solutions, and we're seeing solutions at community levels. And when I think about community, I think about two big institutions: the schools for youth and workplaces for the working adults. And in both places, schools got started sooner than workplaces, but we are seeing an accelerated interest in genuine concern in the workplace around making a difference and understanding that excellence and a flourishing organization, a successful organization, depends at the core on health of its people, and especially its mental health, the mental health of people. And just coming around to the issues around young people and where we can intervene at a community level, I think it's really, really important for us to consider that although there's a slight increase, as Tom said, in some of the rates of serious mental illness, the very significant increases in mental health have happened in a relatively short period of time, which tells us that this isn't about a change in our genetics or the biology of humans. It's about the communities we live in and the systems and structures that we've built. And we've built them, so we have a chance to change them here so that they really support people to flourish today. And I think that that's what people are putting out to discuss and to discover. And we have a lot of dynamic movement forward. So I think one of the things that we really have to focus on are the models that will provide direction so that others can adapt and build and enhance where the foothold that we have.
Well, Kathy, thank you very much for those points. And I really do appreciate the work you've been doing on the workplace and how we can have a healthier workplace. I think that is, a community that's been underserved when we talk about communities. So I'd like to move along to Dr. Ruth Shim. As a psychiatrist and an extensive research background on mental health disparities and inequities, I wanted to ask you today if you could really highlight what are some of the challenges that we face in design of our current mental health system as we move towards a more inclusive health system, behavioral health system.
Thank you. It's really great to be here and among this esteemed panel. And I so appreciate that question, Joe, because there are aspects of things that I agree with Kathy about where the work needs to focus in and originate from. But I also am far less optimistic than Kathy about the current state of affairs right now. And Tom shared some really important data around who has mental illness and how many people who have mental illness and substance use disorders aren't getting treatment. And one of the statistics I like to draw from is we've looked at studies of minoritized communities that show, contrary to the beliefs that we believe of why people don't seek mental health and substance use treatment, we think about things like stigma. We think certain populations have a lot of stigma that prevents them from accessing services, or we think certain populations have cultural beliefs that cause them to minimize their symptoms and not really focus on, maybe they're focusing on other things other than mental health and substance use. Maybe they're too busy, worrying about their jobs and prioritizing other family commitments. But really, when we've looked at the data around why certain minoritized populations do not seek mental health and substance use treatment, cost is really the largest reason why people do not seek care. And so that really stems from a mental health care system that was designed and has a significant number of private providers that take cash only. We've created kind of a two-tiered inequitable mental health care system in which if you're very rich, you can get reasonable care. You can get some of these cutting edge treatments that we've talked about, that we've seen improving. But if you are of middle income to low income, you will not be able to access quality care services. And we built out many incredibly good services through Medicaid and through public insurance. But people still have great difficulty accessing even that type of care. And so for our communities, and particularly for those people that are the most marginalized in our communities, which oftentimes are people of racial and ethnic minoritized groups, but also other identities that are commonly oppressed, like LGBTQ populations, women often in many settings. In those populations, people aren't able to access the care that they need. And we are finding that communities are having to take matters into their own hands. They're having to build out systems to be able to kind of support each other. And we have a very rich tradition of that in our society, but we need to do more to be able to support that work that's happening on the ground.
Really want to thank you for that. And I think that if we don't build an inclusive system, I don't think we'll see the gains that we want. So really appreciate all your work and effort on that. Continuing to move us along and touching on our 5 key priority areas, I want to turn to Linda Rosenberg. Linda's had many significant roles, but the one that probably relates to the question I'm about to ask her is that she's the former president and CEO of the National Council for Mental Wellbeing, which did a ton of advocacy work to build out and improve our system of care. Linda, my question to you is, as we approach system change for mental health, what's your biggest concerns and optimism about changing the system?
So, the optimism, of course, I echo Kathy, the awareness and openness, people in all age groups to have talking about their stress, their illnesses, the need for care. But I want to underscore what Dr. Shim talked about, which is how hard it is to get care. And then we have another issue, how hard it is to get effective care. And I would include working people who have insurance, and who can't get care because much of psychiatry, psychology, and even social work now require cash up front. So that's a major concern. The other concern I have that I haven't heard anyone else talk about, so I may be, wrong, is our interest in the rhetoric around social determinants of health. Because I think what's happened is we're expecting healthcare to create a social safety net instead of creating one, as in other developed countries, which exists apart from healthcare. And I think we've got to think about that because we're struggling with healthcare, and now we're going to take on all of the things you need for a social safety net. I'm not optimistic we can do that well. I think the other thing for me, again, is to go back to effectiveness. And so I would challenge certainly delivery systems, and I call them systems because we don't have one healthcare system nor one mental health system. We have lots of systems delivering services. And I think their struggle is effectiveness and measurement at the site of service to see if what they're offering has any impact or any positive impact. And I think for the public, the struggle is what do I need to be educated about? What do I need to be supported for? And then what do I really need treatment for? And what's the effective treatment for my problem? I think most people don't know that or understand it. And that's kind of our next phase, I think, in terms of awareness and openness. And then finally, I would say for philanthropy, if you want to go beyond the individual or the small group, I would encourage you to understand the environment, including the financial environment. And that means both the public and the private sector, private equity, venture capital, what's happening before you undertake a major commitment. So that's where I think we are today.
Thank you, Linda. I appreciate that. I just want to remind folks that are participating in the webinar today to use the Q&A function to load up questions. We'll do our best if time allows to get to them, but I know that Kristen and Allison will do their best also to help answer questions after the webinar. What I want to do in this next round of questions for everybody, trying to keep your answers as brief as possible. Think about the 5 priority areas and maybe focus on one of those priority areas as it relates to the question that I'll ask you all. I'm going to start off with Kathy. If we think about, our goal here is really to have people live longer, healthier, more fulfilled lives. What would you say is the greatest challenge to building out a system? It's a big question that would allow healthier, longer lives.
So I think, Joe, one of the things that I think about a lot, having worked in schools and working now leading One Mind at Work and working with organizations from small nonprofits, startups to large multinational corporations, is that one of the biggest challenges I see is that we are stuck in systems that are legacy systems that are not the way we would structure them today if we were going to start over, right? So the issues that Ruth and Linda raise about equity and access and the way we work, for example. So I think one of the biggest challenges we have right now is grappling with the vested interests and the systems, the segments of society that are benefiting from the way the systems are that are structured right now, and thinking about how do we actually infuse our systems? How do we infuse workplaces with a different metric for return on investment, for example? How do we infuse our workplaces with an understanding of the role of health, mental health at the center of what excellence and performance looks like? So I think a big piece of what we have to do is rethink some of the incentive structures we have to get to this issue of around equity and around access, and we can do that we have to recognize that that there are vested interests that we are up against, and that we need to think really creatively about how to move forward with what we know so that we can have the outcomes we all wish to have.
Thank you, Kathy. This question is for you, Ruth. How can philanthropy support implementing what works for all people?
Well, that's a tough question, actually. But I think if we were to start thinking about what role does philanthropy play in this space, I have to go back again to agree with what Kathy was saying. The system works the way the system was designed to work. And we have designed a system like we have designed all other systems, including our healthcare systems in general, to benefit and advantage a certain small number of people and to disadvantage and harm a large number of people. And so we designed the system this way. And one of the reasons that we continue to have struggles in people being able to access healthcare, being able to afford healthcare, is because of the way we design the system. And then we took that a step further, and given our general distaste for people with serious mental illness and substance use disorders, we designed a dysfunctional system by which to attempt to treat people with these conditions. And we think about substance use disorders and the way we kind of outsourced the medical component of this disease to implying that it is a disease of your spirit, in which you should be treating these conditions within faith-based settings like churches instead of medical settings like hospitals and clinics. Not to say that really effective treatment hasn't happened in these settings, but it implies that substance use disorders aren't medical conditions, which we know that they are. So the system functions the way we want it to function, and we've really kind of set it up this way. And so the role that philanthropy could have is thinking about restructuring the system, and investments would go towards how do we change the calculus of the system that we've designed to make it a more equitable system. How do we transform the way that we're thinking about structuring the mental health system? So, and I often say that what's great about philanthropy is that unlike the research that comes out of NIMH or other traditional academic places for funding, philanthropy has the ability to take risks. Philanthropy really should be kind of moving the field forward into uncharted territory, and then the more traditional funding dollars can kind of flow from that. And I don't feel that philanthropy has always been enough of a risk taker around what could happen to address these things. So we've heard about all this, the crisis, and how the system is so not functioning the way we want it to, and we know the promise of what it could be. And philanthropy could really fill that gap in terms of pushing us forward, and in funding people that haven't traditionally been funded, that actually have solutions, who've created, again, on the ground solutions to these challenges, and giving money that doesn't traditionally flow in those settings to those folks who have come up with innovative ways to make workarounds in the system.
I really appreciate your raising this goal for philanthropy to be to take greater risks. I would even use the word to be more disruptive in their funding. I think that would be terrific. I want to move to Linda, and we talk a lot about the behavioral health workforce, and I'm curious how you think philanthropy could be supportive when it comes to helping to build out, support the behavioral health workforce.
So I have some thoughts about that, but I generally have a thought about philanthropy investing in what we currently do that we're not doing well, rather than creating another pilot or another project that doesn't have the ability to become sustainable. So I think that's a caution. And I would talk about the workforce in terms of the largest group of professionals that we have working that are licensed are social workers. And I'm a social worker. I know a little bit about social work education. And I know that there is very little attention to effective treatments within social work curriculum. They do a far better job on social justice issues than they do on treatment. And so I think that's an easy area to get involved with without even spending that much money. I've been involved in a small project in the past in New York around teaching interventions for people with the most serious mental illnesses. I think the other thing is we have to move beyond peers. We've invested a lot in the peer workforce. I think we have to think of a community workforce workforce. I think for many immigrant families, the road into middle class has been the healthcare professions. I think we have an opportunity in many communities with large immigrant populations to look at training and supervision. By the way, I don't think training works unless there's ongoing mentoring and supervision. And we certainly have a project like that at Columbia called Engage. And I think there are other projects like that, taking community people. So I think there are things we can do, but I think we have to question what we're currently doing, both in workforce. Also, we have opportunities in CCBHCs, but we have to make sure they do what the promise was in the 60s of community mental health centers, which is serving the whole population of a community. And I think that's going to be a challenge. And even school-based services, I'm thrilled about the financial investments, but Joe, I visit school-based clinics, and many of them are treating children without ever working or seeing or supporting families. So I think research and evaluation of what we do is another important area and part of our attention to communities.
Thank you. I do appreciate your comment on caution. I think that, when we talk about risk taking, it should be, measured against caution. We don't want to do harm as we think about advancing the field. So I really appreciate that. And I also appreciate your comment about looking at degree programs across the continuum and how we can, put people to work in a way that is more efficient and effective. I want to quickly move to Tom. And, as we think about the workforce and crisis services, again, trying to center philanthropy in this, how can philanthropy align its investments around the area of crisis and or workforce?
Oh, Joe, I think some of this builds on what we've already been talking about. You've talked about philanthropy as risk-taking, as Ruth said, and you mentioned the term disruptive. I think what I would add is the opportunity to be catalytic, because there's a lot happening. Linda said this in that first set of comments around, there's a lot of money flowing into this sector that wasn't there before. And a lot of it is federal, some of it is state, depending on the state. So as a philanthropist, I would follow the money and I would figure out how could you make investments that build in not only opportunities to improve crisis and improve workforce, but essentially require accountability. When I look at particularly the federal investments, but even some of the big state investments here in California, what I see missing is the feedback loop, the accountability loop, that there isn't really anybody minding the store to make sure that the money is actually having the impact we want. There's a lot of focus on the process of getting the money out, but not much of a focus on making sure it's doing what it needs to do. There's a place where philanthropy can actually improve population outcomes by focusing deeply on impact and ensuring that we're getting the kind of measurement and the kind of data that we need, which honestly is not happening in a lot of the programs that we're looking at here in California, but also those that are somewhat new coming from the federal government, especially some of the 988 programs and a lot of what's happening around workforce. So big opportunity there, and not one that I've seen a lot of people take advantage of.
Thank you for that. So I'm looking at my watch, and we've got, I guess, about 10 minutes before we have to hand it back to Allison to kind of wrap this all up for us. So what I'd like to do is give each of you about 2 minutes. And what I'm going to give you a big question that I want you then to make better sense of than I'm going to state it. I think that obviously we're talking about philanthropy, and I think that we're talking about where we can be optimistic, where we can be change makers, how we can impact these 5 focused areas of putting mental health at the center. So I guess what I would ask you within the 5 focus areas and everything we've talked about, what is the one thing that you want funders to take away from this conversation today? And instead of my calling on someone, is there anybody kind of ready to get there? 2 minutes.
Sure. I'm happy to kick us off. A key takeaway that I think is really important for funders and for philanthropists is to do the research so that you are sure to engage with evidence-based programs that have the potential to have real impact. We have far too much good intention and good money and good resources that are invested in programs that are sub-threshold to have real impact. And we wind up in the field of mental health measuring process variables. We wind up with nonprofit organizations reporting on how many kids they've seen or how many downloads they've had. But seeing kids and downloading information is not what we're trying to impact. And getting to that end game of real impact of enhanced mental health and putting the dots together rather than creating 50 little organizations that are all sub-dose. It's like giving the prescription of penicillin for strep throat that's supposed to be at 100 milligrams for 10 days, instead giving it at 25 milligrams for 3 days and saying, well, maybe let's hope it works. Let's get to dose and at threshold and connect the dots for the end point impact that we're trying to aim for.
Perfect. Move from outputs to outcomes. Thank you. Who wants to go next?
I can jump in and just to build on that, because I do think I always get nervous when I hear evidence-based, because I always want to say whose evidence, right? And so I just also want to remind us all that oftentimes what we determine is evidence is are studies that have been done on a very small population, a small and homogeneous population, and we're extrapolating from that to think that it works for everybody. And so sometimes we have to just make sure when we're talking about evidence that we're thinking about how inclusive and how equitable we have been in the gathering of that evidence. But my one point would be, I like to quote Brian Stevenson, who said that we have to get proximate to the suffering if we're going to understand and try to address equity issues. And so for philanthropy, I would say absolutely in the field of mental health and substance use disorders, there has not been enough money focused on populations that are minoritized, that are oppressed, that are marginalized in our society. We absolutely know that oppression and marginalization leads to poor mental health and leads to substance use disorders. And we are not investing enough in those populations, and not just putting money towards those populations, but investing in the people in those populations that are doing the on-the-ground work, that are having success in their communities, figuring things out on their own. And so my big push would be for philanthropy to think about how can I invest more in communities that are doing the work, and think about changing my funding priorities to be more focused on populations that haven't traditionally received a lot of money.
And I would focus on two things. One is we haven't talked about technology at all, and I'm optimistic about technology in terms of bringing transparency as well as increased effectiveness. And I think the not-for-profit organizations that exist need to be rebooted. And I think it's in the private sector that's kind of preparing for that as they move the technological solutions. So that would be one area. And then to build on what Ruth said, when I hear from families, how they're treated hasn't changed. It's actually gotten worse. So we've created lots of things, but if you talk to people who have wound up in ERs, who have wound up in inpatient services, they are really, the level of disrespect and poor treatment is quite astounding. So I'd encourage philanthropists to be mystery shoppers sometimes and go through an intake process themselves, even at a mental health center, and see what that feels like before they decide on their investment. So those would be some of my suggestions.
Well, I'll just jump in.
Thanks
I really
for bringing...
like these comments a lot, and I would second all of them. I think the only thing that I would add beyond what's already been said is as you look at this field, it is quite different than the rest of medicine. If you've done cancer philanthropy or cardiovascular donations, that's hugely important, very focused on research often, lots to be gained. This is something different because mental health is so cross-sectoral. It's not just a medical problem. And we often say in this space that, we make the mistake of thinking that health is all about healthcare. And yet the data say that health is about maybe 10, 20% of it's about healthcare. 80% of it has to do with lots of other stuff. And so I think as you get into this area, you have to be thinking about education, criminal justice, housing, and healthcare, but just a whole range of other areas that you need to bring into focus in some way. And part of what I like about that roadmap that Mindful Philanthropy's put together is it really has that kind of context. It's saying, it starts off with community saying, hey, we're not going to fix this just by increasing the number of clinics. We're going to have to understand this in the context of a community and why it is that people are ending up incarcerated instead of in healthcare, why it is that schools aren't really the center of gravity for youth mental health. So a whole bunch of questions like that I think are going to be important to address as we get into this next phase over the next 3 to 5 years. I'm super hopeful, and I think there's a lot that's going to happen. I agree totally with Linda that, technology and AI is going to change our ability to do this at scale. No question about that. We're already seeing that. But getting from access to quality and getting from input to output to outcome to impact, those are really different kinds of efforts. And that's where I hope we can move.
So really appreciate that. And because you were so succinct, I'm going to give you one opportunity to make a plug for a program that is up and operating today that you think people should pay attention to, that is in one of the 5 priority areas. So you get a pitch, just mention the program, and then we'll turn it over to Allison. But I see, Linda, you're smiling. So you must have one.
I have to, right? I have to mention a program supported by my at least part-time employer, Columbia. I do think Engage has promise, both in terms of training a community workforce, but also addressing the needs of a community for paths forward. And I think it can be built out in many interesting ways with the support of philanthropy. Perfect.
Tom?
Maybe I'll do, I again, shameless promotion here, but Fountain House, which is a clubhouse in New York City, is, I think, just done extraordinary work for 75 years. They're now going national, and they're raising the funding to become a national organization that brings the hundreds of clubhouses in the United States to a new standard of care, which I think is really interesting, and there's a huge opportunity. And if I could just think about one additional thing is doing the same thing online. And so I co-founded a company called Humanest Care, which basically builds community online. It's like AA online, but mostly for youth. And so doing that across universities and now across the world has been super exciting.
Thank you. Kathy, and then we'll close with Ruth.
Yeah. We at One Mind at Work have developed in partnership with Columbia and with Ethisphere the Mental Health at Work Index that is a tool that will enable organizations, leaders who are deciding how to expend resources in their workplaces to improve mental health, and gives them an enormous amount of information and tools to spend those resources effectively and have impact. And I think back to Tom's point, so much of mental health happens outside the healthcare system. So would invite people to join us in that way.
And Ruth?
And I'm going to recommend a program that I have no affiliation with whatsoever. So I'm fully objective. I would say BEAM, Black Emotional and Mental Health. It is a program that was founded by Black people focused on wanting to improve the mental health of Black people in their communities, and built from the ground up into a relatively large nonprofit that provides support and resources to the community. So exactly the types of programs that need investment to build and grow, and I think that's a way forward.
Well, as I get ready here to turn it over to Allison to make the closing comments, I do want to thank the four of you for being succinct and thoughtful in your comments so we could cover as much ground as we have. And I want to apologize to all the folks that put comments into the Q&A that we may not have gotten to. I am confident that whether it's in the guidances that will come out in the days to come, or through other mindful publications, we'll make sure we get your questions answered. So again, I just want to thank you all and turn it over to Allison.
Great. Thank you so much, Joe. And thank you again to all of our panelists. Thank you to Tom and to Linda, to Ruth and Kathy. Really appreciate your comments. I know that there were a lot of gold nuggets today. I know I'm kind of sitting with, the system works the way it was intended to, and we have to be mindful about creating, a new system that is inclusive of all populations. And, around Tom's comment around philanthropy can hold these other investments accountable. And Ruth and Joe around being disruptive, and how can philanthropy really be disruptive and take risks. And then Kathy, for you, just the comment you made around a flourishing organization depends on the mental health of its people. And that's true no matter where we are, whether it's a nonprofit, a business, a health system. And that's why we included community really as that anchoring point in our priorities. And so we're so grateful for this time. As we mentioned at the beginning of our webinar today, tomorrow, the full guidance, a roadmap for investment, will be available. And for those of you that attended the webinar or signed up to get it, it will be available with the webinar in the email. And so we also want to encourage you over the next few months to identify 2 of the priority areas that you want to explore further. That you want to do a deep dive into. We're happy to also have follow-up conversations with you on those 2 areas, but really helping you to think about how could they be integrated into your existing giving areas and your portfolio. Additionally, we encourage you to collaborate with other funders doing this work. In the spring, Mindful Philanthropy will host regional gatherings for funders to deepen their collaboration around funding mental health. And if you're interested in partnering with us to host one of those in your area, please reach out. We have a number of cities already defined, but would always be open to coming where there's interest. And then finally, of course, we started this time with the Moonshot Challenge for philanthropy that we issued a few weeks ago. And so we want to encourage you to think about how you can increase your funding to mental health and respond to the challenge that we've issued. If you're a funder and you want to explore that, please reach out and we can help you think about what that might look like. There is tremendous interest, and our goal at Mindful is thinking about how this can be a coordinated strategy for philanthropy and how we can make sure that these investments are going to the most impactful opportunities that are out there. And then lastly, as we close out our time today, you will be redirected to a survey. At Mindful, we're an organization that is always incredibly interested in learning and growing. And so we would really welcome your feedback on how we can do that with our webinars, And of course, anytime if you want to talk with us about our guidance or things that you would like to see us put out. So again, we are so grateful for your time today. Thank you again to our panelists and to our moderator and for your presence here today. Thank you and have a great rest of your day.